Communicable diseases. We'll start from communicable diseases, our respiratory system. We will do this session according to following learning objectives. First, we will discuss the classification of respiratory diseases. Then, we will discuss measles. Then, we will discuss mumps. And then, we will discuss rubella and chickenpox and H. influenzae. In the end, we will summarize the session. So, let's start with the classification of respiratory diseases. Respiratory diseases are transmitted from droplet infection. They can be bacterial, they can be viral. So we can classify them according to virus. Some of the respiratory diseases are viral and some are bacterial. Measles, mumps, and rubella are viral diseases of respiratory system. They are measles, mumps, rubella, and chickenpox. They spread from viruses. Then H. influenzae is bacterial disease. Diphtheria is also bacterial disease. Pertussis and tuberculosis is a bacterial disease. We will discuss these diseases one by one. Let's start from measles. You can see this disease transfers from person to person through droplet infection. If preventive measures are not taken, they spread rapidly. They are highly contagious. They spread from person to person and form a propagated epidemic. When we take preventive measures like we wear masks, transmission can be slowed down. So, measles. Measles is a viral disease of respiratory system. It is more common in children, although it can occur at any age, but it is common in children and it can be severe in children. We take a lot of preventive measures to stop measles. We do vaccination. Vaccination is added in the schedule. Let's discuss. This is the rash. Measles is known by rash. The rash starts from face and then spreads towards the body. Rash of measles is of pinhead size. What is epidemiology of measles? What is distribution of measles? If we discuss distribution, we'll discuss distribution according to time, place, and person. At which time it is more common? At which place it is more common? Who is getting the disease? It is predominant in winter season. Measles is common in winters. Place, overcrowded places. Urban slums, overcrowding. Measles is severe in malnourished children, children less than 5 years, under 5. What is incubation period? Incubation period is a time period from invasion of organism in the body till the appearance of signs and symptoms. Roughly, incubation period of measles is 2 weeks. Period of communicability. For how long it remains communicable? Measles remains communicable for 1 week. It is important because we have to isolate the case of measles. And mode of transmission. Mode of transmission is droplet infection. Diseases of respiratory system spreads from droplet infection. What are the determinants? Measles is caused by virus. Which virus? Paramyxovirus. And under 5 children get the disease predominantly. What is the environment of measles? Overcrowding. This is a common university question, that dry label epidemiological triad of measles. So you must remember the agent paramyxovirus. It is predominant in children under 5 years. Overcrowding is the main reason. What are the clinical features of measles? You have to remember three things. Number one, fever. There is mild to moderate fever, not high grade fever in measles. So we can say mild to moderate fever. Then rash. Which type of rash? Maculopapular. We have to remember the pattern of rash. It starts from face, then go towards trunk. Rash is of pinhead size. Because you have to diagnose measles in the exam from scenario. They can say that a child under 5 years of age has rash which started from face, then extend towards extremities. And he has mild to moderate fever. What is your diagnosis? Your diagnosis will be measles. Then Koplik spots. Koplik spots. What are Koplik spots? Koplik spots. Pathognomic sign of measles. They are pinhead size. They appear on buccal mucosa. We can diagnose measles from Koplik spots. So you have to remember Koplik spots, rash, and fever. Sometimes they ask that a child under 5 years of age have Koplik spots on buccal mucosa. Child is malnourished. What is your diagnosis? Diagnosis will be measles. So you have to remember these spots. As the measles is more common in children, you can see that rash appears from face. It is appearing in children. Then you can distinguish it from chickenpox. How? A rash of chickenpox is of larger size as compared with rash of measles. You have to remember the pattern of rash also. How will we manage a case of measles? We have to take certain measures. Which measures? There are some preventive measures. We have to prevent measles. Measles is a viral disease and we can prevent it. What measures can be taken? First, we have to isolate. Isolation is the first step. Why we isolate? Because we want to limit the spread of measles. So child with measles is isolated till 2 weeks. Then notification. What is meant by notification? We will notify higher authorities that there are cases of measles in our area. So they will do surveillance, they will do screening, and they will isolate these cases. Then health education. Health education can play a vital role. We have to educate parents regarding spread of measles, regarding isolation, regarding diet. So nutrition can be improved. Plus, we need to improve the hygiene as it is more common in overcrowded places. Measles spread from fomites. So we have to do disinfection. These are the general measures. We can prevent measles through vaccination. So vaccination is a specific measure. We have to take specific measures. We need to vaccinate the children. We can give single vaccine or combined vaccine. Dose of single vaccine is 0.5 ml. It is given intramuscularly. Measles vaccine is added in EPA schedule. Measles vaccine is given at the age of 9 months and 15 months. So you have to remember the time. 9 months and 15 months. Plus remember, during epidemics, measles vaccine can be given at the age of 6 months till 15 years. There are vaccination campaigns to prevent measles. So you have to remember the dose, you have to remember the route, and you have to remember the time of vaccination. This is specific protection of measles. Measles can be severe in malnourished children. Measles can be severe in children under 5 years of age, although it can occur at any age. So, question usually asked in university is regarding prevention. So you have to remember the preventive measures of measles. Then we will discuss mumps. Mumps is also a viral disease, but it affects glands. It affects parotid gland. As you can see, there is swelling of parotid gland in mumps. Mumps occurs in children of 10 to 15 years, or we can say it is predominant in children of 10 to 15 years. There is swelling of parotid glands, so there is difficulty in opening the mouth. There is pain in chewing. It also involves lymph nodes. It spreads from lymph nodes and spreads throughout the body. What is epidemiology of mumps? We can say distribution according to time, place, and person. It is more common in winter season. All the respiratory diseases are predominant in winters. They are all predominant in overcrowded places. Person, children of 10 to 15 years. What is the incubation period of mumps? It is 2 weeks. Mode of transmission is same as measles. It spreads through droplet infection. If we draw epidemiological triad of mumps, it's a viral disease that is caused by myxovirus. So you have to remember myxovirus. That is causative agent of mumps. And host, children of 10 to 15 years. Environment is overcrowded environment. Common in slums. It is common in areas where there is overcrowding. What are the clinical features of mumps? You have to remember swelling of parotid gland, either unilateral or bilateral. Clinical features, swelling of parotid gland. It involves lymph nodes. Which lymph nodes? Submandibular and cervical. So you have to remember the names. Submandibular and cervical. There is pain. There is difficulty in opening the mouth. Child may not be able to eat well. Mumps spreads through lymph nodes and causes enlargement of testes and ovaries. It involves heart. So, what is the management of mumps? We can do general preventive measures. What are the general preventive measures? Isolation. These are same as measles. Notification. Health education. Disinfection. Hygiene. What are the specific measures of mumps? We have to take some specific preventive measures like vaccination. Vaccination can be given at any age. It can be single or combined. Always remember the dose 0.5 ml. Route is intramuscular. So we can prevent mumps. There is also symptomatic treatment because there is pain in mumps. So we can give painkillers to reduce the intensity of pain. If it involves testes and ovaries, we can do testicular decompression and oophorectomy in case of complications. Testicular decompression. And oophorectomy. As you can see, virus enters into respiratory tract and it spreads to local lymph nodes. Then it spreads to distant lymph nodes and spreads to testes. It causes orchitis. It can cause carditis. So mumps is lethal cause it can cause severe complications in both male and female cause of spread through respiratory route and through lymph nodes. So you have to remember that cervical and submandibular lymph nodes are involved in mumps. That's why it spreads to testes and spreads to ovaries. Now we'll discuss rubella. Rubella is a is a viral disease of respiratory system. Also viral disease. It, it spreads through rash, but it spreads through vertical transmission. The main difference between measles and rubella is that rubella also spreads from vertical transmission or it spreads from mother to fetus. It also spreads from respiratory route and vertical transmission. You can see the rash of rubella. Starts from face, spreads to body. So we can say that rubella is common in winters. It is common in overcrowded places. It is common in children and female. As female of reproductive age, its incubation period is 2 weeks. Mode of transmission. So you have to remember mode of transmission. It's a common MCQ. The mode of transmission of rubella is vertical and through droplet. It's droplet and vertical. If we draw epidemiological triad, rubella is caused by toga virus. Host, children and female of reproductive age. Environment, overcrowding. What are the clinical features? Remember, fever, mild to moderate. Rash. You have to remember the pattern of rash. Rash starts from face, spreads to body. But when it spreads to body, rash from face disappears. So it's disappearing rash. Once it moves to other part, it disappears from first place. So you have to remember this. Plus, there is congenital rubella syndrome. In case of vertical transmission, rubella virus transfer from mother to fetus through placenta and can cause congenital anomalies. Congenital rubella syndrome causes ear defects, eye defects, and heart defects. As you can see, it can cause patent ductal arteriosis, cataract, and deafness. This is classical triad of rubella. So when rubella crosses placenta, child is infected or fetus is infected. When child is born, he borns with certain congenital anomalies. This is a common university question that a child born with deafness, cataract, and patent ductal arteriosis, mother had infection during pregnancy. What is your diagnosis? Your diagnosis will be congenital rubella syndrome. And in case of rubella, it is characterized by rash. A rash appears on the body of child. It disappears from face, then appears on trunk. This is rubella. So you have to differentiate from congenital rubella syndrome and rubella. Plus, remember, you have to protect female of reproductive age. You have to vaccinate them. This is rubella infection. Deafness, cataract, heart disease, congenital rubella syndrome. This is also called German measles, and we can protect by vaccination. So you can remember this through this picture. It spreads when infected person cough or sneezes. Human beings are the only reservoir. Here, it is transmitted to placenta through placenta to fetus and causes congenital rubella syndrome. What is management? What is prevention in case of rubella? General preventive measures are same as that of measles and mumps, like isolation. You have to isolate case of rubella to stop transfer of infection. Then notification. You have to notify to authorities. Then health education. You have to educate. Then disinfection, as it spreads from mites. You can improve diet. You can improve hygiene. These are the general measures. What are the specific measures? We can give vaccine to female of reproductive age. This is RA27 3. Single vaccine. Dose is 0.5 ml. Every female of reproductive age is given this vaccine. We have to vaccinate children. And rubella vaccine is combined with measles vaccine nowadays, that is called MR vaccine. MR vaccine is given at the age of 12 months, at, at the age of 9 months, and 15 months. This is included or added in EPI. And plus, in case of epidemics, it can be given at the till the age of 15 years. You can give rubella vaccine to children. So you have to vaccinate female of reproductive age and children to prevent rubella. Vaccination of female is extremely important because it spreads through placenta. It can cause congenital rubella syndrome. It's a common university question. Now, we'll discuss chickenpox. Chickenpox is a viral disease that spreads through rash. You can see rash of chickenpox appears on trunk, then it spreads to face. Difference between rash of chickenpox and measles is size of rash. Size of rash of chickenpox is larger. It appears on the whole body. What is the epidemiology of chickenpox? It is common in winter. It is common in our crowded places. It is common in children. Incubation period is 2 weeks. Mode of spread or mode of transmission is a droplet infection. Chickenpox spreads through varicella zoster virus. So causative agent is varicella zoster. Host is children, or it can occur at any age. Environment, overcrowded environment. Chickenpox is characterized by rash. You have to remember pleomorphism. Dewdrop appearance. What is pleomorphism? All the stages of rash, macule, papule, vesicle, and scab are seen at one stage. Drops appear and then disappear. There is dewdrop appearance of rash. Rash is present on trunk, then spreads to mouth. It may cause other symptoms like cough, fever, but rash is predominant in case of chickenpox. Plus remember fever. Fever may be mild to moderate in case of chickenpox. Sometimes the virus becomes dormant and after few years it spreads through nerves, spinal nerves. It can cause herpes zoster infection. Herpes zoster is complication, or we can say that after remaining dormant, virus reappears after 10 to 20 years and causes herpes zoster. And herpes zoster spreads to nerves and can cause encephalitis. The virus spreads to brain. What is management of chickenpox? Symptomatic management. We can treat fever. We can give antibiotics. We can give antitussives. Paracetamol is given in case of fever, antitussive in case of cough. And we can give immunoglobulins to prevent chickenpox. Sometimes in case of herpes zoster, we can give antivirals. H. influenzae, Haemophilus influenza is a bacterial disease of respiratory system. It is also present in winters. It is also present in overcrowded places. It is common in children and people of old age. Disease is more severe in children and older people. We can say that. H. influenza is causative agent. Predominant in children and old people. Common in overcrowded places. Incubation period is from 2 to 3 days. It spreads rapidly. Initially, influenza had pandemics. Pandemics are controlled through vaccination. But there is problem with mutations. There are genetic variations or genetic mutations in case of influenza that are shift and drift. Shift is sudden change and drift is gradual change. Influenza spreads through birds and human beings. What are the clinical features? Flu and fever are most common clinical features of influenza. We can manage influenza through vaccination, through general preventive measures like isolation, notification, health education, disinfection, hygiene, and specific measures are vaccination. Influenza vaccine is added in EPA schedule. It is given at the age of 6 weeks, 10 and 14 weeks with pentavalent. Vaccination has improved the immunity. It has reduced the mortality due to influenza. It has reduced the pandemics of influenza. Plus, vaccination can be given in winter season to children and older people, to those who are vulnerable. And influenza, these are the common symptoms: fever, chills, pains, shortness of breath. These are common symptoms of influenza. Hemophilus influenza is causative agent. It transfers from person to person. It can cause meningitis as a complication. It can cause pneumonia. It can cause airway blockage. It is lethal in children and may cause death. So there is need to control influenza. There is need to manage influenza. We can also give antibiotics cause this is a bacterial disease. So antibiotics can also be prescribed. Antipyretics. This is treatment of influenza. Plus, we can give vaccination. So we have to take dual action. We have to prevent. We have to treat. We have to protect our children. We have to protect our older ones. We have to protect our immunocompromised people. So we can control influenza. It's a preventable disease. It's a treatable disease. We can limit the spread. We can use masks. We can isolate them. Now, we will summarize the session. We have discussed communicable diseases of respiratory system. We already discussed that they are viral and bacterial. We discussed that measles, mumps, rubella, and chickenpox are viral diseases. We discussed that Haemophilus influenza, pertussis, diphtheria, they are bacterial diseases. Then we discussed measles and chickenpox. Now we'll see the difference between measles and chickenpox. Fever is common in both measles and chickenpox. In measles, there is red rash that first appears on forehead. Then there are red irritated eyes. This is sign of measles. Running nose. But then there is cough and cough-like spots, which are pathognomic signs of measles, which appear on buccal mucosa. In chickenpox, rash appears on trunks, then spreads to face. So there is loss of appetite in chickenpox. So these are the major differences of measles and chickenpox. Both measles and chickenpox are viral diseases. Measles is caused by paramyxovirus. It is common in children under 5 years of age. It is severe in children, in malnourished children. And chickenpox, it may appear at any age. Rash starts from trunk, then spreads to face. What is the difference between rash? Rash is of pinhead size in case of measles. In chickenpox, rash of pleomorphism. Macule, papule, vesicle, and scab appear at same stage. There is dewdrop appearance of rash. In measles, there is fever. Fever is also present in chickenpox. But remember the age difference and nutritional difference. Measles can be prevented as well as chickenpox can be prevented, but we need to give vaccine of measles at the age of 9 months and 15 months. Vaccination of measles is included in EPI. Chickenpox is self-limiting disease, less lethal than measles. Vaccination of measles is mandatory for every children. Remember, the usual time is 9 months and 15 months. But in case of epidemic, we can give vaccine at the age of 6 months till 15 years. There are campaigns, door campaigns. Cause measles can cause death. Mortality of measles is much higher than chickenpox. Chickenpox occur at children of older age. Rash disappears after 2 weeks. Symptoms disappear after 2 weeks. We can treat symptomatically. But the problem with chickenpox is herpes zoster. Virus become dormant, appears after 10 to 20 years and causes herpes zoster, which can involve brain, which can cause encephalitis, which is lethal. We can give immunoglobulins in case of chickenpox. In case of measles, vaccination plus immunoglobulins. You must remember, in case of measles, vaccination plus immunoglobulins. In case of chickenpox, just immunoglobulins are required. What is the difference between measles and rubella? Measles causes pneumonia. It can cause diarrhea. Children may die due to severe diarrhea. Diarrhea causes dehydration. Both measles and rubella causes brain damage. They can cause deafness. Both can cause blindness. But heart abnormalities are common in rubella, in congenital rubella syndrome. So you can remember the complications of respiratory diseases. Because these are diseases of respiratory system, they cause pneumonia. They can cause encephalitis. They can cause heart abnormalities. They can cause ear abnormalities. They can cause brain abnormalities. They can cause eye abnormalities. But measles predominantly causes diarrhea. Then we discussed mumps. Mumps involves glands. It involves glands and spreads to lymph nodes. Mumps involve submandibular and cervical lymph nodes. There is difficulty in opening the mouth in mumps. There is severe pain. One gland or both glands are involved. Mumps is present at the age of 10 to 15 years, or it is more common at the age of 10 to 15 years. When it spreads to lymph nodes, it can involve systems like it can involve testes, causes orchitis. In female, it involves ovaries, causes ophritis. It can cause carditis. So in case of mumps, we need to give painkillers with vaccination because there is severe pain. We need to give liquid diet to children. And in case of complication, we have to do testicular decompression and oophorectomy. So mumps is dangerous if it causes complication. Otherwise, it is self-limiting disease. We can give vaccination. Remember, in case of measles, mumps, and rubella, combined vaccine MMR is given, or it can be given. Dose is 0.5 ml. Or we can give single vaccine in case of measles and rubella. Nowadays, vaccine of measles and rubella is given at the age of 9 months and 15 months. Or we can say that combined vaccine of measles and rubella is given at the age of 9 months and 15 months. It is included in EPI schedule. Rubella vaccine is included. And we can give, in case of epidemics, we can give this vaccine at the age of 6 months till 15 years. Mumps vaccine, chickenpox vaccine, they are not included in EPI. And we discussed Haemophilus influenza, it causes flu, it causes fever, it spreads to lungs, it can cause pneumonia, it spreads from birds and human beings. There is shift and drift mechanism involved which causes mutations. Shift is sudden change, drift is gradual change. There were pandemics of influenza. It caused mortality. Nowadays, due to vaccination, due to better treatment, due to preventive measures, mortality is reduced, morbidity is reduced due to vaccination. Influenza vaccine is included in EPI schedule. It is given at the age of 6 weeks, 10 weeks, and 14 weeks. Plus, vaccination is given to children and to older people at winter season cause it is predominant in winter season. We can also give antibiotics in case of H influenza. So you have to remember few things. Few things are common in all diseases like they spread from droplet infection, but rubella can also spread from vertical transmission. Measles, rubella, and chickenpox are spread through rash. Our rash is predominant in measles, rubella, and chickenpox. But you have to remember the features of rash. Rash of measles starts from face, then spreads to body. Rash of rubella also starts from face, but it disappears from face, then spreads to body. Rash of chickenpox shows pleomorphism. These are common features. Complications, you can remember pneumonia, you can remember encephalitis. So this was all about respiratory diseases like measles, mumps, rubella, chickenpox, and H influenza.